Welcome back, everyone. Now, we move to our fifth item in the agenda, the panel discussion entitled Virtual Reality and Simulation in Skill-Based. For this exciting session, I would like to call upon Dr. So Chiu Fei, who will be the chairperson of our honorable panelists, who are Professor Dr. IRTS Vinesh Tiruselvam, DVC, Research and Innovation, Chief Innovation Officer, APIIT Education Group, Dr. Siti Azrina Mubin, Lecturer, Soft Engineering, and Professor Dr. Sharifah Sulaiha Haji Said Aznal, Associate Dean, Clinical Affairs and Development. Now, I would like to request the speakers to switch on their cameras and microphones.
Hello, good morning.
Hi.
Can you all hear me?
Yeah.
Hi.
Good morning, Dr.
Morning.
Sir.
Can hear you.
So, hello, I'm Saw, the director of IMU Clinical Skill and Simulation Center. A very warm welcome to all of you to this panel of discussion, which is based on virtual reality and simulation in skill-based teaching. I'm really very happy to chair this session. So we'll begin by just giving you talk a little bit about this pandemic, which is actually posed a very big challenge to many of these skill-based training. All this has actually caused a short-term closure of university. And of course, because of this, it limits our student-patient interaction in the clinical setting. And also, in fact, in the lab-based, the student-teacher interaction is also reduced. So we are now actually have to rely on technologies to help us in our deliveries. Therefore, we already felt that this panel of discussion come in very timely to share some of the teaching strategy and also the delivery for the skills-based teaching using technology and also, of course, the new thing like virtual reality and augmented reality. So today, we are very honored to have three very distinguished panel of these speakers to discuss and share some of the insight into these topics. We will invite actually each of the panel speakers to speak for a few minutes, and then we will open the floor for questions and for discussions. You may put your question in the chat box and we will address your question at the end of the presentation. So without further ado, I would like to introduce our very first speaker. That's the Professor Dr. Engineer Vignesh Tiruselvam. Sorry, I'm so sorry with the pronunciation.
No problem.
So Professor Vignesh is a very distinguished speaker here he's a deputy of a vice chancellor and also the chief innovation officer at Asia Pacific University of Technology and Innovation, which is APU or APIT. So his primary objective is to build the engineering and also our ICT expert that will actually educate and in parallel with developing a lot of future talents and professional for the country, which is really much needed, especially at this point of time. And now we are very excited to have you with us, Prof. And so you may begin your presentation.
Okay. Good morning, everyone, and thank you, Dr. So, for the introduction. And I want to also, on behalf of myself and Dr. Siti, who's also my colleague, thank IMU and for this opportunity to speak this morning at this panel forum. But also congratulate IMU in their motion forward in this area of VLE. And I think you've done great things. Now, taking the topic in concern, virtual reality and augmented reality for the purpose of teaching is not something new. It has been there for some time now, but it has taken a very strong, steep skills requirement shift for any form of education, not only for the medical industry, but also for other industries or disciplines. Simply because of the current situation we are in, whereby a lot of things are being delivered on a remote basis. Now, technology is an enabler, and within the context of using technology, we have these two sharp areas of virtual reality and augmented reality. They are simply two contemporary simulation-based models that are basically being used now in many forms of education. The reason behind is because with virtual reality, you get to see a very three-dimensional and a dynamic view of different forms of structure. Yeah, when you can see a fixed structure in a 3D 360 view, it allows the user to interact with that structure. And that is one key area that virtual reality has allowed for the form of education. Now, they also, if I take into the medical context, in the spirit of IMU's VLE exercise or showcase today, there have been many technological advances in areas such as haptics, whereby it allows also for display systems or any form of motion and how you want to detect motion. And it's best via VR, because the VR is an ideal platform or tool or technology for training on hands-on procedures. Now, I take it and I relate it as an engineer as well to the medical profession. When you can actually experience interactively, that is a very different form of learning, especially in the scenario or condition of virtual learning or remote learning or e-learning for that matter. So these are different fields of application that you can now adopt in your education delivery. So I've just spoken about virtual reality. So if I move forward into augmented reality, there is also the ability to project virtual information, or even if you use the same structure of an artifact or physical object, yeah, and you can now place that same object or structure by altering the environment it is in. So you augment it into a different environment. Now, what the augmented reality technology has allowed for is when you integrate AR, you can now understand different anatomical structures, physical mechanisms under different conditions and environment. So it also allows you to, further deploy different hardware and platforms, so that you can have that effectiveness of VR and AR. Because at the end of the day, it's all about the principles and the standards of how it functions. And many studies have shown that these methods are actually having very, very strong impact in terms of having that feel of study, even if you are remote. Now, taking this into consideration, there are many areas that people are looking at the moment in terms of innovation towards online learning or virtual learning environments. And one of it is very simply the area whereby, in terms of the pace of learning. So the pace of learning is one area that you have to keep up with. And the second part is the complexity of learning. So at this moment in time, the repeated study mechanism is available through technology. So a large body of evidence or teaching materials or recorded can be done by using technology. Now, if I look at the point of VR, a lot of VR simulation in any industry, even in healthcare, a large body of the evidence supports VR simulation. So VR is not a panacea. It's actually a very powerful educational tool that can define learning objectives and learning outcomes. And the implementation is growing worldwide. So in conclusion, I just want to state that the future of VR and AR lies in the ongoing process of integration into curriculums. So as technology evolves, and you will get further developments. You will be allowed to share that simulated experience. So when I say simulated experience, I not only conform to clinical, laboratory, experimental. Uh, these experiences can be done in a form of future AR, VR, AR implementation. So this will facilitate quality interprofessional education at a larger scale. You know, it is independent of geographical presence. You can be anywhere, learn at any time at your own pace. So the transformation, how we deliver this education, will take its paradigm shift starting now. Yeah. So that is my start to today's panel discussion. So I hope I've given some inputs there, Dr. Sao.
Yes. Oh, sorry. Yes, can you hear me now? Yeah. Thank you so much for your sharing for this talk. We will take the question from the panel, from the audience at the end of the speakers. So let me introduce our second speaker, which is Dr. Siti Azrin Mubin. So Dr. Siti is actually from academia. She's from the Faculty of Computing, Engineering and Technology from the Asia Pacific University. And her research interests are web engineering, web design, virtual reality, augmented reality, and also gamification, which is really a paramount for student engagement nowadays, which is a big challenge for all of us. So we would like Dr. Siti to have an opening speech for this discussion. Dr. Siti, you may begin.
Hi, hello everyone. Good afternoon. Thank you, IMU, for having me. So I think most of the about AR, VR already mentioned by my colleagues, Prof. Vinesh. And I just want to add on the virtual reality Tinji over here. So there are already 10 ways where virtual reality already being used in education, especially in skills training, as what our topic today. Other than skills training, also virtual field trips, language, how to learn new language using virtual reality. And then they have architecture and design as well. So how about the skills, simulations and skills-based training? What is the purpose when we have a virtual reality to have these skills training? Okay, we can learn practical skills, and also we can learn from the realistic scenarios without the risk of practicing an unfamiliar skill in an uncontrolled real life situations. There is an experiment done by Google's Daydream Labs, but Google's Daydreams already discontinued in 2019. But this is the experiment that done by them, where they have two groups of users. One group where this group of users, they're using virtual reality training to learn how to in a coffee making, and another group is just using or just watching YouTube tutorial. So from the experiment done on the coffee making, the one that experience using virtual reality, using virtual reality practice, they made fewer mistakes and they have a quicker at pulling the espresso shots, which it means they provide a better results when they are using the virtual reality. That one is done by Google's Daydream Labs in 2017. Okay, so we look at another, like most of the universities in US, especially like in UCLA, University of California, Los Angeles, they train they have a training for new surgeons that using their surgical theater using virtual reality. And another university named Case Western Reserve, they're using a virtual reality as well to teach virtual anatomy. So in Malaysia, this trend is still new for us. So we are in the development phase still. And one of the issue here is the cost. Okay, when we talk about XR, extended reality, which is virtual reality, augmented reality, and mixed reality, is about the cost. The latest devices that where I think is reasonable to buy is Oculus Quest 2. It just recently launched Oculus Quest 2, which is cost, I think, $299 US, around 1,300, 1,400, which is, I think a few of my colleagues already bought that one as well, because they already experienced our XR lab in APU, so they really enjoy using the Oculus Quest that we have in the lab. So the latest one is Oculus Quest 2. So most of them already bought that for their personal use. And like my class, I'm teaching AR VR module. So most of them, they have to experience the virtual reality thingy. So since of this pandemic, we can't have them in the lab. So what I instructed them to do, just buy Google, not Google, sorry, is a VR box, the virtual reality box. So the virtual reality box, the simplest one we call as the Google VR box, which is cost like $3, $4, even though it can DIY, means you can make it by yourself from a cardboard. It's a Google cardboard. Then what you have to do, just slot in your phone there, then you can experience the virtual reality thingy over there. Some of them can afford to buy 20 ringgit, 30 ringgit VR headbox. So what I did in my class, because I want them to experience the virtual reality there. So they have to slot in the smartphone and experience the virtual reality. That is the cheapest. And I think one of them already have Oculus Quest. So I think no issue from that side. So that is one of my suggestions. If like we educators, academia, if we want to experience this skills training based on the virtual reality, because of the cost, first, because if we want to experience the immersive experience, 6 degrees of freedom, where we can walk forward, backward, vertically, left and right. So that one is a 6 degrees of freedom. So that one we have to use, no choice to use the Oculus Quest. But just for the 3 degrees of freedom, which means just to rotate your head left and right, then we can use the Google VR box or the cardboard, or also we can buy the what we call this VR box, which is cost like 20 to 30 ringgit. You can get it easily from Shopee or Lazada or any online seller there. That is on because all these skills training, they have the VR video they already created, like in YouTube. Okay, so example like for medical, maybe you want to see the anatomy. This is for AR, augmented reality. So there are a lot of apps. Example like Assembler, ASSEMBLR, Assembler app. So you can download that app. Okay, then you can have an augmented reality experience there. You can choose. There is a lot of what we call that, a lot of categories. Medical, there's a tourism, animal, there's a lot. So example medical, so you can project it anywhere, so they will pop up on your screen there as an augmented reality. The one is Assembler app, ASSEMBLR. You can try to look at it later. Virtual reality, I can suggest Within, WITHIN, Within app. But as I said, if you want to really experience that, you must have the VR box. That is the cheapest and simplest one. I think that's all from my side about skills and simulation training. I think about XR technology, VR, AR. Dr. Chu?
Yes, sorry, I'm trying to on my video. I think they blocked me. Okay, but never mind. It's okay. I think you can hear me, right?
Yeah,
so
yeah.
Thank you so much for your sharing and opening speech. We will take the question also at the end of the of all the speakers.
All
so
right.
let me just introduce you to our final speaker here, which is someone from our very own institution, Professor Sharifah Sulaiha Syed Aznan. So Professor Sharifah is an EXCO member of the Malaysian Association Education in medicine and also in the health sciences since 2017. She's responsible for the training of the teachers in our HPE program. And she presented and also conducted local, international, and quite a number of the scientific conferences and workshops in bioethics, in the clinical areas, in the health professional education, and also has numerous publications in ISI index journals and books, which is related fields and in medical education. So we are very fortunate to have Prof. Sharifah here with us. Prof, you can begin your opening speech.
Thank you, Dr. So, for that very lengthy introduction. Okay, I think Prof. Dinesh and Dr. Siti Azrina has really made my life easy because they have given a lot of input on what is available out there and what is this not so new technology. As we all know, it is there, but perhaps in certain areas or certain disciplines in our country, for example, medicine, we all know we are a little bit behind in terms of using technology in our not just the learning, the teaching learning, but also in our clinical practice. So I've been asked to perhaps, I don't know whether this is a debate or it's an argument, but perhaps to give my view on how technology as VR, AR, immersive virtual reality or simulation can help skill training. And we all know with the pandemic, things have changed very fast, and we need to be the advocate if it's not that we are also embracing the change, because the new generation needs to be educated as well as trained differently if it's not the same way that we've been trained for the last 50 years. So I thought I prepared some slides just for visual aid. So you don't have to, you could follow as to what I'm trying to argue here. I hope everyone can see. Can you see the slides? Yeah? No?
No, we can't see the thing yet.
Not yet. Oh,
Yeah.
sorry. Maybe I forgot to share the screen. I'm sorry. Okay, can you see now?
Yes, yes, we can see now.
Okay. The topic or the discussion is whether there's a role, or I take it as whether there's a role of VR or simulation in skills training for medical student, or we could probably also discuss this not just for the undergraduate medical students, but also for our postgraduate trainings. Yeah, and I feel definitely there is, because if you understand what virtual reality means, it's just a software that we can use. I mean, Prof. Dinesh and Dr. Siti Azrina have already explained there are many apps from the cheapest to maybe the most expensive for us to use, but it's how we use it and how to be creative in our teaching or with students to be learning it. And the reason why I thought virtual reality is something that we all should be looking into is because the traditional simulation sessions or simulation training that we do, it's requiring us to be there, to be present physically, and it's face-to-face. With the pandemic, we know that that is definitely something that we all cannot do. It's an obstacle for us to even be there with the students. So there must be a way as to how we can continue with the training, because skills needs to be trained in a way that they would experience it and they feel that they are engaged in the environment. So I thought that's why we all should consider this and discuss this and collaborate with others who have ideas as well as experience in using virtual reality. I'm sure in engineering, in aviation, you all have been so advanced in using technology, whether it's the VR, the AR, And even now, like Dr. Siti Azrina mentioned just now, using the Google, I can't even remember what was it called now. The goggle, the goggle. We can have an immersive, interactive virtual reality. And I have seen many works from the other region. Yeah, we all know Americans are very advanced in this. And Oxford Medical Simulation Clinics, for example, have done so many or have produced many videos or YouTubes that we can actually follow, and then to show how they have experiment using virtual reality to do ward rounds, having interaction with patients, with other colleagues also involved in the experience. And this can help the students not to just do the practical session or have the practicality of doing the skills or the procedures, but involved in a lot more, which is very important in clinical practice, especially decision making, clinical reasoning, because they are there, they are going to experience it. And what is also another thing that is very important is it allows us to interact with the students, to debrief, to give feedback. And I think we heard Prof. Karp this morning has mentioned as to how this is super important. And we educators all know our job is no longer as an information provider, but also to facilitate learning. And feedback is one way as to how you can facilitate. Yeah. So I thought now I'm a bit embarrassed because we are with people who are experts in this, but I just capture just a video. I'm not sure whether you can see this now. Can you see now? So
the video is not playing.
Okay, is it playing now?
No.
Okay, so maybe I have to. So it's not playing?
Prof. Sharifa,
Yeah,
you need to drag the video to the screen because you have shared different screen.
Oh, okay, sorry.
We are still seeing your slide.
I still see the slide, so I have to stop the screen sharing first. Sorry.
Yeah.
Okay, let me just stop this one. Yeah.
And make sure you have tick the sound from computer to be tick there.
Okay.
Thanks.
All right. Okay. This is also to show you how. Okay, wait. How clinicians most of the time are not very techno savvy. So it's good that you invite me on top as the last speaker compared to the others. If I'm gonna just try this, yeah, see whether we can see the video. It is not something that is very secretive. It's in the YouTube. Can you see the video now?
Yes, yes.
All right.
On. Yeah.
Can you hear it?
No sound.
What about now?
No sound.
No sound. Can you hear them?
No sound.
No sound, yeah. What about now?
No. Some scratchy sound at the back, but not coming.
Okay, what about now? Can you hear it?
No.
Okay.
Prof, you can unshare and I can share.
Okay, can you share it for me?
Sure. Just unshare your screen.
All right, sorry. Let me just unshare this first. Okay. You wanna try to share?
Yes, I'm sharing. Yes, hold on. Okay. Oops. Is this the one, right?
Correct, yes.
Okay.
Today, like usual, and about 10
Can you hear the sound?
Yes, yes.
minutes into my run, my chest started to hurt, and I felt short of breath.
Huh. Okay. And when was that?
About an hour ago.
Okay. Do you have any medical problems?
I don't have any medical problems.
Do you take any medications?
Just Tylenol and ibuprofen every once in a while.
Okay. Well, let's get him on monitor and put an IV in. Can you listen to his heart and lungs?
Yeah, sure.
Thanks, Dr. Lin. Checks pulses.
I'm starting to feel really lightheaded.
Okay, let's go ahead and drop a leader. He's a little tachycardic. Let's get a nasal cannula on him, the oxygen. Let's get CBC, chemistry. Also do a trope and D-dimer. Chest X-ray, EKG. How are his pulses?
2+ on this side.
Yeah, I had the same on this side. No,
Okay,
sure.
I
Tell
think,
me more about your chest pain.
It hurts on the
that's
left
all
side.
this. Yeah. All right, thank you. Can I share this? Or you want to continue the sharing? Hasnain?
No, I already stopped. Now it's yours.
Okay. Okay. Just a snapshot of that video just now to show as to how virtual reality can actually help us in helping the training for not just for skill, but beyond that, especially when it comes to decision making, clinical reasoning. But it looks as well. I thought it looks expensive, but now that Dr. Azrina has explained, we could actually be innovative. Perhaps this is a potential for us to collaborate with people who have the experts or the people who have the expertise of doing this to help medical schools or any health professions for training. Yeah. I pulled out an evidence to say why I thought we have to move towards this. Maybe I sound strong, but I feel that though there are a few small studies out there, as we all know, usually medical education studies are very small. There are contradictory findings, but what I like about this one is it shows that virtual reality, if we are using for the right purpose, and this is actually on surgeons, yeah, and postgraduate trainees who are doing laparoscopic surgery. They found that it's actually significantly faster. There will be there's a greater improvement in the subjects who are using virtual reality for their training, and there's better economy of movement. What does it mean? Is that the shift from problem having errors as well as complications from the surgery is significant from when it's done by this group who had virtual reality simulation. So I feel that definitely there are benefits. Yeah, we can talk about challenges for sure. Most of the time when we talk about challenges, it's about how would people accept, how would the teachers be trained, how are we going to prepare this in terms of infrastructure, resources, whether our students are going to be ready to accept this change. But there are a lot of benefits here, especially if whatever that is happening right now during this unprecedented time because of this pandemic is going to continue. Yeah, it allows our students to make and to improve their performance because they're going to continue to learn through this deliberate practice. Yeah, and we all know in clinical practice, mistakes is very expensive. Yeah, when we talk about patient safety, for example, or safety of even of our own colleague. Mistakes or errors are very expensive. There was a study that shows that actually mistakes in hospitals or on clinics or mistakes to patients are costing a lot more than if you have a plane that crashed. So it shows how sometimes, because perhaps it's not a big thing that we all talk about, that the errors are there, errors are a lot, but it's not, it's not, what would I say? It is not something like if you have death by a plane crash, but it is over a period of time, there is actually a lot more and it's more expensive. Yeah, so we talk about how do we improve to ensure that the safety of our patients and safety of our own healthcare professionals can be looked after. Not only that, I think we all know this, it encourages engagement, the learners can actually take charge of their own learning, and whether you noticed it or not, if you think about it, it reduces costs, because when we have we invest in this, yeah, space is no longer a problem. When we thought about space, we are talking about having a huge infrastructure to accommodate students for face-to-face or when they are physically present. Not only that, facilitators can be trained, and facilitators can actually be from anywhere. It doesn't have to be from your own place, because we can collaborate. So there's a lot of benefits here, and if you over a longer period of time, there's actually going to be a reduced cost if you think about it. I don't know whether people would kill me for that, but I thought if we talk about where would our future lies, especially we talk about clinical learning or clinical practice, again, it is about clinical competency and as well as patient safety across all systems. Yeah, and we can learn a lot from other programs, especially like I said, the engineering, the aviation people who have done this simulation check with now even virtual reality, augmented reality for zero error. Yeah, and we have not had that. We haven't been able to achieve that yet. It's not been a success yet. And like I said, again, we can learn remotely, and we have a lot of opportunity for collaborative learning in a real time. So it is not just within us, but it could be across the globe. So that's all from me, Dr. So.
Yes, thank you very much. Thank you so much for your sharing. I definitely have to agree with you about the patient safety and the cost versus impact of error. I mean, definitely this is a big talk, and all of us have been talking about it. So now, because of the time, we will now open up to the floor. And do you have any question? If anyone have any question, you can just leave your hand up. I think the facilitator will unmute you and also give so you can speak. If not, you can put it in the chat box. Is there any? Sorry, I'm trying to. Okay, so maybe I can start my question. You know, I was just thinking about all three of your speech and just now. One of the important thing is, you know, at this point of time in pandemic, many of us wanted to actually start to do something about it. I mean, not because it's, even though it's been there for a long time, but I think in the medical field, at least for us, we have not really embarked into it. So what are actually the strategy if you were to should an institution approach if they want to start using this VR and AR into the skill-based teaching? What kind of approach do you think you go? Can you give us some advice on that? We can start from Professor Vignesh, maybe, because yeah.
Sorry, my video is off. I couldn't turn it on.
Can you please on the video for Professor, please? Can you try again?
Okay, all right. Okay, great. All right. As a start, right, I think there is already a future shift to remote learning, not only for the current scenario, but I think the adaptation and the adoption of technology has always been on cards. It's just that the current pandemic has taken a twist and a paradigm shift, sort of changing the pace of using technology for delivery. Now, if I look at the current practices and how future practices will be deployed, I think it's no longer a question whether an individual can obtain or access facts, but it is more on how they can use these technologies, evaluate them, and apply and deploy them for education delivery. Now, the simulation itself, it's an educational technique. So, because it involves creating situations that replicate real life, it allows a learner to act like as if they would do in real life. So I think in the perspective of the medical scenario, I strongly believe that this simulation-based learning will allow for the cross knowledge exchange, that where you can actually give some feedback, and you can also do debriefing on performances, especially some of the clinical or surgical performances. Simulation is effective from different or in many domains. It is definitely uh, has been found to be superior to traditional clinical education. Because what it does, it produces that intervention. And in education, you always need that intervention that can yield you a sort of immediate and lasting results. So your performance output and your results from simulation allows you to have that better practice and self-paced learning. And in this case, I think whether it's nursing, clinical, medical, any form of that kind of education, it is very effective for healthcare education. The use of simulation-based delivery. In this case, of course, we were talking specifically on virtual reality.
Yeah, definitely, I agree with you. But do you see what is the impact on the accreditation body? Because ultimately, I mean, we're all worried about accreditation and having a new thing, introduction, and that in your point of view, what is the impact on the accreditation body, especially to us, which is which is very new, and acceptability and stuff like that. What is your view about that?
From an accreditation perspective, right? You have your standards, which is based on face-to-face. During this current scenario, we're learning to transform into e-learning.
Yeah.
Now, moving forward, if you can justify, and that can be easily done, the performances and the sort of results, which is very similar to face-to-face, then I foresee that what we can do for the future is deploy a hybrid method of education delivery. So we don't focus on what is going on now. If we say same time next year, when things are hopefully back to normal to a certain level, you might want to deploy a sort of a hybrid approach. Because then it is not only from the form of teaching, but it's also on the form of learning. I think the medical profession in different subsectors will basically move on to adoption of technology in further practices. So I think this transformation has to happen now, so that we are experiencing and exposing this growing demand of technology infusion for the healthcare education. That's my view. I think it should be a hybrid, and I think MQA should be able to accept it based on the justification that you show, which is very similar in terms of outcome effects against the face-to-face method.
Yeah, I agree with you about the hybrid. The move towards hybrid, and also of course is getting a strong justification. I think that is one of the things to get the accreditation body to come in. Now coming back, my next question I have is, you will be open to maybe Dr. Siti, since you mentioned about the cost. Is there any strategy in the cost management for Dr. Siti? Is there any strategy? Because I think you mentioned quite a number of things about cost, because cost is a real headache for all of us at this point of time. Yeah.
If from a student perspective, because there's question about how about the cost from student side to visualize our experience. As I said, the cheapest is zero. What I mean by zero, because you can create the Google cardboard just using the cardboard, but it's very tedious work. You have to cut with your knife, all the kind of things, and then there's a manual you have to follow. It's quite tedious. I think the reasonable or worth it that you can buy like 3 ringgit. You can just Google. You can have it from Shopee, Lazada. They're ready with a Google cardboard there. So you just, when you arrive at you just assemble it. You slot it together, then just put your smartphone, then you can experience your VR there. So how you find the content from YouTube or from the Within app that I mentioned. So they already have all the content, then you just choose which one you like. The one is from the student side, the cheapest. The worth it, the one that I have here, this is VR head box. This is right 30 ringgit, 30. So this one, but this is 3 degrees of freedom, example of virtual reality headset, head box here, which it means 3 degrees of freedom means you only can rotate your head left and right till that's all. 6 degrees of freedom, which is the Oculus Quest, you can have a more immersive experience. You can walk forward, backward within the area. So that one, the one that I said, the cost like $299 US.
Okay, so that is the student's perspective. How about the for us to build the thing itself? Because we are all now thinking what we want to build. How do you want to go about that?
You mean to build the lab like we have in AU?
Maybe starting the program itself, we need to come up with some cost strategy. Do you think you can give us some kind of tips on
I think the cost strategy, Prof. Vinesh is a suitable person to answer that.
Yes, definitely, Prof.
On the costing, I was just going to type it out actually, because someone asked the same thing on ROI. I think with regards to VR, AR, it's very similar to any form of technology or software for that matter. So even if you're using, say, a software now, which you can do coding and programming. Now, every year you have a license for that software. Now, moving forward, there'll be versions of it. So there's an upgrade version. So when you pay for that upgrade version, you're paying for the tech evolution of that software. See? So similarly, VR and AR will evolve. And, it's scary because technology is evolving even as we speak. So whether it's 3 months, 6 months, 12 months, we have now built our VR AR studio. And having built it, we know that it has possibly more room for improvement. And we're looking at how we can improve it for different purposes outside just teaching and learning and research. Likewise, the investment could be in two forms. You could have an investment that helps you for teaching and learning and the simulated practices that you want to deploy. But then if you want to do enhanced research, then you have to invest again. So the question about how much we research and an ROI is very debatable, because an ROI for an education institution is very much based on two forms of income. One is student fees, for that matter. So students come on board, they come into a curriculum that is, as we can see, very techy, very sexy. The way forward of learning and the practices that I gain from this curriculum allows me to have a better job marketability. So then they come on board. So then you have that student volume that actually contributes a fee, Now the other part is, if you have these facilities and you can in some form do research to support the industry, then you get again funding coming in. So I think the ROI is very questionable, but you can see a fast change in terms of demand for the programs that are attached to the provision that we are developing. So for example, in our case, right, we have developed this studio, and we can see the numbers increasing. Now, the numbers increasing, there are two parts to that as well. Your numbers can increase based on the scale whereby they are now shifting from another program to this particular program. But there are also numbers that come in directly into the program. So it's two forms. Yeah? But for me to calculate an ROI, it will depend on the number of students that we get.
Yeah.
And we see good potential.
Yeah.
It's safe to invest, especially when the investment is something that tackles the requirement of the future for the discipline, for the curriculum, for the profession.
Yeah. We actually, thanks for showing us your beautiful lab. We are very impressed when we visited there. So actually, I was really wanted to know, like, how do you, what is your experience? Can you share with us maybe in your challenges and perhaps some tips? How can we do it better if you want to maintain a lab, like, you know, a virtual lab? How do we do that?
Okay, I can answer this together with Dr. Siti. Right.
Yeah.
Whenever we want to build a lab or a studio, the first question is that space is functional. So what am I going to put into that space? Now, what am I going to put into that space means who is going to use that space. So who is going to use that space is the number of people that will utilize that space. So that determines how large a space for the studio or lab. Now, what also goes in is what are the types of equipment that or infrastructure that you're going to put into the laboratory or studio. Now that is determined by what you want to do it as a functional space. So what we initially designed it for was, we knew that we would put functional first. So the studio would do virtual reality, augmented reality, and within those two areas, we had to come up with something which is futuristic. Hence why we have the extended reality, the XR, which is a combination of the mixed reality of virtual and augmented, but also now capturing something which is never been done before, which is very holographic. So we have done that. Now, on the augmented side, we knew that we would have a sort of a green room, a closed door, a closed curtain space. So again, that space had to be designed. Now, the third element was the seating capacity. Now, how many students do we want, or how many researchers do we want sitting inside? So we optimize the space for sort of a 6x3, which means that I can have a class of 18 people. So not only research, but I can actually teach a class of 18 people inside that space. And that is what we defined as the spacing criteria was required. So once I got the space from management, we outlined the entire space according to a setting up plan. So that setting up plan included how the functional areas would work. So the extended reality was a functional area. The volumetric capture, which was the green space, was one area. The teachers' teaching table and how they would set their presence from a talking perspective, from a deliver of a lecture perspective was one area. How the seating would be very conducive and interactive. Those tables were designed. We also had to have a HD TV where we would, we didn't want to use a normal whiteboard. We wanted a HD, and that was also deployed, and where it was positioned, ceiling mounted, wall mounted. Again, that whole functional space. Because what's very important at the end of the day, it is the experience.
Yeah.
So,
and getting the design, yeah.
So the experience of the person in the functional space is very important. And I think you got that when you came. You came and got the feeling and experience, and that's what we wanted. And that's what happened in your upcoming design of a studio or a lab for that.
Yeah. So I think having a good lab, knowing how to maintain definitely is one of the key things, but I think still you need the people to drive it, the right people to drive it. And our challenges, I guess, in the medical field was because of convincing the people, because you can see that, even though simulation is not new, virtual reality is not new, but we are quite slow in terms of this. So I think we mentioned about, so my question actually would be maybe open to Prof. Sharifah. How do we actually convince the people in our healthcare to actually embrace this technology to us in the medical field?
Okay, thanks, Dr. So. Actually, I asked the same question Prof. Kak this morning as to whether it is the drive by the policymaker, and I think we've heard it has to start from those who believe and advocate this change. If we say, I read an article that says that the generations in the 40s and 50s are the one who are willing to change, and those above the 60s are not so willing to change. I can understand that, and this is the reason. Hear me out. The reason is because these people have had the expertise and worked in clinical practice for so long, and they know that simulation, they don't even need simulation in order for them to be an expert. Unfortunately, things have changed in a way that patients are a lot more hesitant for us to use them for teaching, for example, for students to practice, or for us to say, we got to learn this, or can you please help us? So there's already a drastic change in the environment, and our country is not shying away from that, because our population has grown and become educated. So how do we, perhaps my honest opinion is, we have to start somewhere, and whoever that is that has this vision where this is what we need to do, then we need to work together and collaborate with those who can help us to push or drive this to change. But we also have to be mindful that we are not using any of this or this simulation to replace all competencies. We were talking about certain competencies that can actually be replaced by simulation. Of course, we will talk about professionalism. We've talked about all other things, for example, how to have the empathy and that sort of things. That requires human touch. But we are talking about how some the environment in even the hospitals or even the clinics, by even the clinicians themselves nowadays, have changed so much. Interaction has to be meaningful, and the shorter times that we have with our patients have to be used for things that are going to help us build the competencies that cannot be cannot be achieved by simulation.
Selective. I understand. So I completely understand. Thanks for sharing that. I think I completely understand. So now actually I'm trying to look through in the chat box. I hope we address some of I think in between both Dr. Siti and also Prof. Vignesh actually has run through and some of the questions and answer some of the things. Is there any, because of time, I just want to sort of wrap it up. Is there anything, maybe like some last minute sharing you want to wrap up your sharing, and any best advice, take home message, so we can start each of you, maybe just a short 1 minute, then we can just wrap up this. Prof, would you like to share some insight and take home message for us?
Okay, definitely. I think technology is here to stay, and the adoption of technology is a given go ahead, whereby all forms of education deliveries has already started. I think the justification towards technology adoption is simply because it is going to be used in practice for the future by the future professionals that go into the job market. But technology itself is a want and a desire by the new generation of learners. So it's a marriage which we cannot deny will have to happen, because as educators, we are sort of sandwiched in between the new learners and the job market requirements that are upcoming. So I think technology will sort of facilitate that desire against the practice of the future. And we have to start it now at tertiary level, for example. And I think a very good example of technology adoption is what we are looking at, which is the VR and AR perspective.
Yeah, thanks for sharing. I think also we can maybe even use this strategy to convince the people in the medical life. Yes, thank you. Dr. Siti, maybe any words, just a 1 minute wrap up if you have. Yep.
We have to start somewhere. So as I mentioned just now, example like the LRF, it can be applied to any of the fields, not just medical, any of a subject. So AR apps, because the apps is already there, the content is there, the modeling, the 3D model content. So you just drag and drop there, then you can like we give exposure to the students at least on the augmented reality over here.
Yeah, exposure and maybe even engagement, because it's also a big challenge for us to, and I really like your specialty in gamification. you really have to give us more tips on that in future about, and how to, because that really is a good way to go forward to in engaging the student.
Yeah.
So much, yeah. And so we have our Prof. Sharifah to say a few words just to wrap up.
I think most of the two speakers have already almost wrapped it all. But what I probably just would like to add is we all have to start collaborating, and the collaboration has to not just be horizontal. Horizontal means among the medical professions, but also vertical with other professions, the engineering people, the technology people. Because I don't think in order for us to advance in medicine, I don't think we can actually work on silo.
Yeah, I 100% agree with you. And that's why we are so grateful to have these people from the APU to come and join us and having this sharing. But thank you so much to all the three of you. We are so honored to have your input, your sharing. And I think we hope to address already most of the questions in the chat box. But because of time, I think we need to wrap it up. Thank you for coming and having with us here. And thank you so much. I just all I want to say on behalf of IMU. Thank you. Right?
Thank you.
Thank you. Yeah. Thank you, everyone.
Have a good day. Thank you.
Have a good day. So I'll pass this to the MC.